SBAR and SOAP are structured communication tools used in healthcare, but they serve different purposes and are used in distinct contexts. This video is a quick breakdown of those differences. SBAR stands for Situation, Background, Assessment, and Recommendation. Its purpose is to facilitate concise and focused communication, especially in handoffs and urgent situations. In my background as a medic and a nurse, I used it typically when something was going wrong, and I wanted to present the most important information and get that quick response. So let me give you an example of communicating a concern. Dr. Smith, I'm calling about Mr. Jones in room 205. His oxygen saturation dropped to 85%. He was admitted for pneumonia and has a history of COPD. He is now short of breath despite oxygen via nasal cannula. I recommend switching him to a non-rebreather mask and evaluating for possible ICU transfer. SBAR is for quick, action-oriented communication, and it's ideal for those emergencies or concise updates. Let's talk about SOAP. SOAP stands for Subjective, Objective, Assessment, and Plan. Its purpose is to organize documentation and patient records for thorough, structured problem solving. It's commonly used in clinical charting and medical documentation to track a patient's condition and care plan over time. I'll give you an example for SOAP. The patient reports, I've been experiencing sharp pain in my lower back for the past 2 days. She rates the pain as 7 out of 10 on a pain scale and mentions it worsens with movement, but improves slightly with rest. No recent trauma or injury is reported. Vital signs, blood pressure is 128/82, heart rate of 78 beats per minute, respiration 18 breaths per minute, and temperature is 98.6 degrees of Fahrenheit. Patient appears uncomfortable, shifting positions frequently. Tenderness noted on palpitation of the lower lumbar region. Gait is slightly impaired due to discomfort. No swelling, redness, or bruising observed in the affected area. Acute lower back pain. No evidence of infection or systemic illness at this time. Administer acetaminophen, 650 milligrams PO as ordered for pain relief. Encourage patient to use ice packs on the lower back for 15-20 minutes every 2 hours for the next 24 hours. Advise limiting physical activity and avoiding heavy lifting until pain subsides. Schedule follow-up in 3 days or sooner if symptoms worsen. Educate patient on proper posture and body mechanics to prevent future strain. SOAP is for detailed, structured documentation, ideal for clinical charting and continuity of care. So, to review, SOAP, Subjective, Objective, Assessment, Plan, organizes detailed patient notes ideal for comprehensive documentation. SBAR stands for Situation, Background, Assessment, and Recommendation. It is a concise tool for quick communication, often used in handoffs or emergencies. Schools may favor SOAP for teaching clinical reasoning, while organizations in fast-paced settings often prefer SBAR for efficiency. But you can go back and forth between the two of them. It just depends on your organization or if you're still in school, because both serve distinct but complementary purposes in healthcare.